Women's healthcare, a rooting issue playing the front fields in furthering poverty and inequality. Munira Gunja, a current worker within the healthcare system, was astonished to find herself lacking support from the very system she worked in. As a pregnant woman, she struggled to find an OBGYN who was available, and the conflict continued trying to get her appointments covered through medical insurance. Due to high medical costs, she and her husband even had to stress to their OBGYN that a C-section was out of the question unless a true emergency came. Munira is just another average woman, but it is these types of average women that are facing hardships from the healthcare system. Many women like Munira struggle and are in a constant battle with the US healthcare system because they're often sacrificing their own health to cut back on medical costs. As a society, we have continued to foster these critical issues that have persisted since the beginning of our established healthcare system. One article discusses the toll of the US healthcare system in terms of mortality rates, stating that despite being the richest nation on earth, the US has a staggering high maternal mortality rate of 26.4 deaths per 100,000 live births. But by comparison, other countries like Finland have a maternal mortality rate of 3.8 deaths per 100,000 live births. That's a stark difference. Every year in the US, between 700 and 900 women die from causes related to pregnancy and childbirth. This high maternal mortality rate should be decreasing with our advanced technology and our new generations, yet it is prevalent and a pressing issue among all women, but especially among women who are in low-income households and communities. Because these women lack the proper healthcare and reproductive services, and it's often due to the unaffordability and the costs for these necessary resources that they lack these access. This leads to increased health problems among women, increased birth rates, and contributes to a higher number of children growing up in poor living conditions. Essentially, the issue of poverty and inequality broadens with more children entering this cycle. High poverty rates increase as more children contribute to the proportion of the population labeled as financially poor. Money, power, bias, judgment calls, and societal systems are all proponents of continuing to breed poverty. But one of the most influential factors that could change this whole thing would be the healthcare system. The current healthcare system within the US lacks providing universal healthcare to all of its citizens, especially women who suffer from various maternal and reproductive issues, and it leaves them without any proper medical care. In order to better combat this issue and combat the effects of poverty and inequality, the United States should implement a combination of solutions, such as a single taxpayer healthcare system, increased MCH clinics. Biased perception of women suffering the effects of economic poverty. Many people's perception of women who lack good quality of health is due to misconceptions and misunderstandings about the issues and its causes. There's often a social bias against these women within low-income communities as either having teenage pregnancies or being sexually unsafe. They don't care. They don't want to be mothers. They don't care for their children. And they don't value motherhood and their health. There's a stark difference in how people see and respect the dignity of a low-income woman versus and single women versus that of mothers who are in their 30s, who have a husband or a stable job. These conclusions and biases are far from the truth and only contribute to more misunderstandings that essentially create ineffective solutions. One of the influential factors that is commonly misunderstood among many that are not acquainted with the hardships of low-income women is that the workplace bias exists against these women, and specifically single mothers. For example, in recent years, gender equality has stalled, including such things as lowering mothers' hourly wages, which contributes to the conflict of women having the ability to take care of their health on their salary alone. Paula England, a revered sociologist, argues about motherhood and its relation to economic poverty, stating that the penalty for motherhood include employer discrimination against mothers, rescued job performance due to the demand of motherhood, and this salary gap in turn reduces the economic well-being of single women and their children. Based on this, the systematic operations of our society are creating gaps for rotting issues rather than refreshing solutions. If women cannot be paid enough to support themselves and their children, how will they be able to prioritize critical issues concerning their health and well-being? This inequality that Paula England expands on will only further generational poverty and can have detrimental effects on the quality of health for these women and children. Additionally, many of these women do not fit the stereotype that they have children that they don't care about. These women love their children, even if they're struggling to take care of them. And as a society, we cannot fall victim to these untrue stereotypes. Sociologist Catherine Eden argues to voice the perspectives of these women, stating, living a life without children is inconceivable for these women, and many describe having children as a life-altering experience. Many felt that their children motivated them to try and improve their living situations, obtain an education, and become responsible parents. Despite being seen through society in opposing and prejudiced lenses, these women fight to provide their children with good lives. And in order to provide effective solutions, we need to respect and care for women living in low-income communities to reduce poverty and inequality. The realm of improving healthcare, in specifics for women, would be a step towards reducing poverty and inequality and benefiting society in the progress. Statistics show that there is a need within this area, as one author, Gabrielle Raley, discusses the concern for young girls childbearing. She writes, the United States still has the highest occurrence of teenage childbearing in the industrialized world at just over 40 births per 1,000 teenage girls aged 15 to 19. The comparable rate is only 22 births in Canada, 13 births in Germany, 4 births per 1,000 for ages in 15 years. The staggering teenage childbearing within the United States enunciates the dire need for women and teenage mothers to have good support systems that provide quality healthcare for themselves and their children. Without a good supportive healthcare system, many of these girls can fall within the poverty index and experience a reduced quality of life. Moreover, this could increase the already high U.S. maternal mortality rate if teenage mothers do not get the healthcare resources that they need. These issues can be worked on, though, through the implementation of a single-payer system within the U.S. and more MCH clinics being available to women living within low-income communities. The effect of single-payer healthcare system on economic poverty in women. One of the possible solutions to the lack of healthcare for women and to fight to alleviate poverty is the implementation of the single-payer healthcare system. The single-payer healthcare system is where the government acts as the healthcare provider, the sole healthcare provider, and they raise funds through taxes paid by their citizens. Through this form of healthcare, the government funds the hospitals directly, and all the associated costs, such as paying doctors, paying nurses, the companies supplying the medical equipment, and the healthcare administration are all paid through the government. This concept envelopes the principle of philosopher Singer, who said if someone is in need, members of society need to step in when they can. The single-payer system is currently being carried out in 17 countries around the world. But the US currently uses a multi-payer system, where there are many healthcare providers. While the single-payer system is not the answer to all of the problems concerning feminine health, and the problem will not be solved entirely, this form of healthcare is a step towards the right direction. I believe the US should change its healthcare system to a single-payer for several reasons. Firstly, since the sole provider in the single-payer system is the government, they can offer universal healthcare, leaving no citizen uninsured. The effects of this policy clearly show, as one article speaking on the flaws of the multi-payer system stated. By comparison, Finland's maternal mortality rate is 3.8 deaths per 100,000 live births. Every year in the US, 700 and 900 women die from causes related to pregnancy and childbirth. Our current multi-payer fragmented system, it leaves a shocking 9 million women without coverage. This lack of providing even the basic amount of medical care to US citizens has resulted in higher maternal mortality rates that could easily be prevented. Healthcare is expensive, and low-income households are forced to make tragic choices, such as paying for rent and feeding their family over getting routinely checkups from their doctor. Women push off their health. And unfortunately, with all the high costs it takes to live healthy, this basic need is often seen as a luxury. This leads to complications that go unchecked, lower quality of health, and possibly even the development of long-term genetic health changes. It begs the question that if other countries can provide better policies and care, why shouldn't the US do the same as well? Moreover, we also view inequality within the healthcare system that puts some women's care above others, regardless of whether the procedure is or the service is the same. One article specifically talks about this bias with medical insurance, stating, trans women may have health needs related to physically transitioning from their assigned sex at birth. The expression of their gender identity is linked to healthcare access. It wasn't until 2014 that Medicare began covering gender affirmation surgery. Many states currently have laws that restrict Medicaid coverage for gender-confirming therapies. This quote emphasizes the reproductive and sexual restrictions placed on women within the healthcare system and how those currently on Medicaid cannot afford to be who they want to be. This inability for women to freely express themselves does not improve their well-being and continues to foster sexual and gender discrimination. Implementation of MCH clinics and their effect on women's health and poverty. Alongside a possible single-payer system, another possible solution to reducing poverty and inequality through improvement of women's healthcare could be increasing more MCH clinics within the U.S. MCH clinics serve to specifically target the betterment of child, maternal, and feminine health by providing services to reduce maternal mortality rates, immunizations, prenatal care, and much more. These clinics often are based in rural areas, and these emergency care services are free of medical cost. This free cost is due to funds and donations collected by the federal government used towards the Title V grant, which allows for the current MCH clinics to function. While MCH clinics are not the ultimate solution, they provide many advantages that outweigh the costs. One statistic shows that the USAID reports that its effects over the past 10 years have helped to save the lives of more than 9.3 million children and 340,000 women. This statistic displays how the MCH clinics are trying to target the possible dangers and consequences of childbirth, saving the lives of many women and children in the process. With more clinics like these in low-income neighborhoods, the impacts would be worth exploring. Many others agree as well, despite the clinics being funded through awarded grants and donations versus constant taxpayer money. In fact, the funding has increased still in recent years to continue these clinics. As one article stated, total U.S. funding for MCH and nutrition has increased over time. It rose from $728 million in 2006 to $1.435 billion in 2022, its highest level to date. MCH funding has totaled to $1.28 billion in 2022 and includes about $848 million for bilateral efforts, of which $253 million of that went directly for polio, and $429 million went for other multilateral efforts that go to other organizations such as UNICEF. Therefore, this increase in funding exhibits that even though it's being funded through donations and grant money, these funds are continually being allocated. Moreover, MCH clinics are not only constricted within the US, but they have also been implemented in many other various countries that have the US's support. This perspective is also critical to consider, because if we're discussing reducing poverty and inequality, we cannot constrict it to the issue of just countries and looking at just the US, because the problem itself is a global one. One article talks about the global impacts of MCH clinics by saying that across US global health efforts, the agency's near-term goal has been to save 15 million children's lives and 600,000 women's lives from 2012 through 2020 in priority countries. These countries account for approximately 70% of global maternal and children deaths. By targeting the areas of the world with the most prevalent issues in feminine, pediatric, and maternal health, millions of lives are saved. This initiative could increase quality of life for many and provide them with their basic needs. Furthermore, this delves into the positive impacts created, regardless of varying factors that the difference of countries provides. Many women and children are benefiting from the maternal and children health clinics, and to hinder the expansion of these clinics would be a disservice to the well-being that we all want all individuals to achieve. In conclusion, while the solutions suggested are not perfection, they support positive change towards improving feminine care, health, and well-being. Both the single-payer healthcare system and the expansion of maternal and child health clinics, MCH, work to reduce maternal mortality, bias within the healthcare system, sex reassignment, and gives children in prenatal care. Where ethics and morals are concerned, some people may feel that the universal single-payer system is too controlling, whereas others may feel like it provides equal opportunities to all. Nevertheless, on average, most people in countries instituting the single payer are insured, which speaks in the practical effectiveness of the single payer system. As for MCH clinics, they have existed in the US for a couple of years and other countries, but are expensive to run, which could be a roadblock towards political feasibility. However, capitalizing on MCH clinics and cutting back costs from the current multi-payer system could vastly improve the practical effectiveness of healthcare in general. So, although both policies of change are not fail-safe solutions, the implementation of both can hopefully be a step in the right direction, averting societies of poverty, inequality, and high costs for low-quality healthcare.